Thank you, Scythe. So I'm now very excited to introduce our keynote speaker for this morning, that is Professor Debra Rickwood. So Debra's name is a name that will be familiar to very many of you. She's a professor of psychology at the University of Canberra and the Chief Scientific Advisor to Headspace, which is Australia's National Youth Mental Health Foundation. So as many of you know, she's internationally recognised as an expert in the area of help seeking for mental health and personal problems, and is regarded as one of the pioneering researchers, if not the pioneering researcher, for all things youth mental health service research related, having led the way in all things R&E in Headspace for the past 10 years. So the pandemic has definitely brought its challenges for very many of us, of course, but I think the being able to have this event online, one advantage of that is that we've been able to have Debra join us this morning. So to that end, I just want to thank her for joining us and agreeing to give this keynote this morning. It is evening time, of course, in Australia. And not only is Debra a wonderful researcher and a pioneering one, but she's somebody who's been incredibly generous with her time and advice to me and colleagues at Jigsaw, but also our counterparts in other youth mental health services. So we're really privileged to have her here. Debra's talk is about 30 minutes or so, and we've got some time for questions at the end. So there is a Q&A feature on the main event page, the page that you're on. Underneath the screen, you should see the facility to submit a question. So you can do that, please, through the talk, and I will put as many of those questions as I can to Debra at the end of her talk. So without further ado, again, I am going to hand over to Debra.
Thanks, Eileen, and hi, everyone. It's a real pleasure to be here with you today, albeit remotely and from the other side of the world. I really wish I was there in Ireland. In another time, maybe I would have been able to be there in person. Having an excuse to visit Ireland is one of my favourite things. And one of my great grandmothers hails from Cork, so Ireland is certainly one of my favourite places, and very glad to be able to work with Jigsaw, which we've done for a long time, and very pleased to be able to share something about the Headspace story so far with you today. But I want to start just with an acknowledgement of country. In Australia, it's our custom now to acknowledge the traditional owners of the land on which we are. So I'm coming to you today from Ngunnawal land, which is just, I have a little property just outside Canberra in Australia. So I'd like to acknowledge the traditional owners and First Peoples. And we have a real focus in Headspace on attempting to improve the well-being of Aboriginal and Torres Strait Islander young people. Now, I wanted to, I was thinking of what theme I might have to pull together the story of Headspace. And what I came up with is that Headspace and everything I've been involved in, it's all about a story of change. And change means replacing something. In Headspace, we're reorienting the mental health system to suit young people in the age 12 to 25. So trying to replace our mental health system with something that's newer and better. And this campaign goes across 4 things that I want to share with you today. So how change is important in the age range of 12 to 25 that we're talking about, how Headspace services have constantly changed since their inception, how change is a real challenge for research, how we're interested in change, but that change in a research context brings us specific dilemmas to deal with, and then finish up looking about change in the future for the Headspace initiative. So that's how I'm going to, that's sort of an overview of what I'm going to talk to you about today. But first of all, just setting the context. Obviously, the age range of young people that we're interested in from 12 to 25 years, from around about puberty to early adulthood, is a period that's characterized by change, enormous change. The change from being a child to being an independent adult. And this change occurs physically, so from puberty to full maturity. It occurs cognitively with major changes in brain capacity and function, with significant social changes and in emotional changes. So change in all the domains that make us human. And around that change, what also happens is extraordinary change in vulnerability and the onset of mental health problems. So most mental health problems start to emerge and become evident in this age range, and hence why we have such a focus on the 12 to 25 year age range for young people. So Headspace was set up in Australia very deliberately to address the changing needs of young people across that age range from 12 to 25. And Headspace itself has undergone substantial change as it has adapted and innovated and responded to our emerging understanding of the needs of teenagers and young adults in Australia. So Headspace was set up like Jigsaw with acknowledgement that the 12 to 25 year age range is a period where we really need to focus mental health interventions, with the understanding that 3/4 of mental health problems first emerge before the age of about 25, that we have a high suicide rate, that about 1 in 4 in Australia, young people will experience a mental health problem around this age range each year. We're aware that mental health is the health concern for this age range. So we need to focus our health system on mental health needs. Young people, though, also, of course, have other needs. So they have physical health needs, and this includes sexual health, which is very important due to the sexual maturity that happens. Young people also have significant needs regarding work and study support because of the major transitions occurring during this life stage. And this is also the time when alcohol and other drug problems and other drug use and alcohol use emerge. So these are the 4 core service support areas that Headspace has been set up to address. We're very aware that around 1/3 of young people in this age range have very high distress, psychological distress, and we need to holistically meet their needs. And Headspace was set up to address these needs and to break down the barriers that young people have for seeking help for these types of issues. So as I said, Headspace has undergone significant changes over our time in response to better understanding and expanding needs. So we started in 2006, funded by the Australian government, and we've been, Jigsaw has also been around and been growing alongside us. So there's been some parallels with Jigsaw as well. But in 2007, the Headspace Centre was over South Melbourne, and importantly, one of the first things Headspace did was form their Youth National Reference Group. So we call that High Energy. So importantly, youth participation was built into the very fabric of Headspace from the start. We then had 4 centres in 2007. In 2008, were up to, we initiated the first family and friends advisory group. In 2011, we went online, and headspace, which is the online phone and chat service, was initiated. And my slides have just gone a bit fuzzy, but I think I can still see them. I've also got some notes. In 2012, we then initiated school support. So understanding that we needed to have headspace services in schools. 2013, our brand awareness now was up to almost about half of the young people in Australia being aware of headspace, and was added onto the headspace platform. 2014, headspace telehealth, so we added telepsychiatry, and we had a particular program around mental health literacy for Aboriginal and Torres Strait Islander young people. 2015, we held the first ever Headspace Forum. 2016, we had a period of substantial change because they changed, the Australian government changed the way they commissioned the Headspace centres. So prior to this, money had come from the government to Headspace, and we commissioned lead agencies. In 2016, they changed so that Australia then had 31 primary health networks, who the primary health networks were given the money, and they then commissioned the Headspace centres. So that was a really major shift for the centres and for us in Headspace National. 2017, we opened our 100th Headspace Centre, and we also partnered with an initiative called Beyond Blue to do work younger and do more work in terms of mental health literacy in schools. 2018, we had our third Headspace Forum. We had a young men's stigma campaign, and we had 108 centres. 2019, at that point, we'd reached 500,000 young people across Australia. And 2020 and going forward, we expanded our digital work and study program, and we were working up to having more than 150 centres across Australia. So you can see from this slide that our centres are dotted across all of Australia in every state and territory. They are concentrated around the East Coast because that's where most of the population in Australia is concentrated. Just to give you a bit of an idea of what this upscaling from 4 centres in the first year to 150 centres and the diversity of that, this is a map of Australia that shows some other countries you might be familiar with in terms of their size. And you will notice that up here we have Ireland, all of Ireland, and you can see Great Britain. And we could drop all of that in the Northern Territory, in the outback in the Northern Territory, and probably have trouble finding it. So Australia is a very big and diverse country, and upscaling from what initially was a small number of centres to cover the whole of Australia has been a story of enormous change. Just to give a little bit of a flavour of the difference in the centres. Some of the first centres were in Sydney, and I'm sure all of you have heard of Sydney, and there's a centre at Bondi Junction in Sydney. You'll all have heard of Bondi Beach, one of our famous landmarks. But Sydney has 5.3 million people. It's about 12,000 square kilometres. Only 3% of the people in Sydney are Aboriginal, and 40% of the people in Sydney are born overseas, and the largest group, 7%, were actually born in China. So Sydney's very multicultural, high density, and some of the first headspace centres were set up there. You can contrast that with the Pilbara region in Western Australia, where we've more recently undertaken an outreach trial. The Pilbara region is a huge area, 502,000 square kilometres, but there's only 60,000 people, 16% of them are Aboriginal, and only 19% of them were born overseas. So the model there, and you can see a couple of the workers there, they recently have got a centre, but they started off, their outreach model was basically in a car. So going out to where people are and having a very different model because of their high Aboriginal population. You can see, just for context, all of Ireland, including the Republic and Northern Ireland, is just about a quarter bigger than the Pilbara. So we have a lot to contend with in Australia in terms of meeting the very diverse needs that young people have for their mental health. So Headspace has had to grow, it's had to innovate constantly, and some of this has been our own ideas, some of it's been foisted on us from the government, and some has come, you know, from young people, from the Headspace network. But as I said, we started off with our youth reference group. We had our in-person centres. The centres, we now have satellites, we now have outposts, we now have outreach, so different models for the centres. eHeadspace was an innovation that was online and telephone, but we now have a whole range of digital mental health programs. So we have group chat, peer moderated forums. We have a whole system we've just implemented called Headspace Connect, where young people can put together a sort of menu of self-directed and supported support for themselves. We have an online digital work and study program and an online career mentoring program. We added on an early psychosis program in 2014. So in 6 urban areas, there's 6 clusters and 14 centres that support young people at high risk of or experiencing their first episode of psychosis. We engaged telepsychiatry, so for rural and remote areas that have very little access to psychiatry, the government funded access via telepsychiatry to psychiatrists based in urban areas. We've had many national campaigns, including Headspace Day, and our Headspace Day this year is next week on the 6th of October. We've had all sorts of campaigns, including Yarn Safe, which was a campaign specifically developed for Aboriginal and Torres Strait Islander young people. We've invested in vocational programs, particularly online work and study support. We've done a lot in the online environment because given the, as you can see, how big and dispersed Australia is, you can't get in-person services to everybody. Online has been something that we've been particularly interested in. And we've invested more and more in working in schools, so trying to get in early with young people in schools. The complexity has also been in how Headspace is funded and how it's delivered. So we are funded by the Australian government through the Department of Health. Originally, the money came to Headspace National, and we then commissioned lead agencies who commissioned the Headspace centres. We now have primary health networks in 31, or we work with 29 regions across Australia, and they commission the lead agencies. We've got nearly 70 lead agencies we work with. We're up to about 150 centres, and we now have new models of care, including satellites, outposts, and outreach. So what started off as more contained has grown in complexity in terms of how we We deliver, we commission, we fund, and we manage the Headspace network of services. Okay, so what about the research? This is our research interests. So we'll have a few research memes. We like research memes in research. It gives us something to laugh about. But research is a real challenge in Headspace because of all the change. Everything keeps changing. In an ideal research setting, an evaluation setting, you implement something, it stays as it is, and you look before and after. That is not the environment we work in Headspace at all. And we are having to deal with constant change to our service and service network. And we're also interested in trying to capture and measure change, which is a challenge in itself. So at Headspace, what we've been particularly interested in, these are the domains of impact that we have wanted to be able to research, to do evaluation around, and also undertake research around. So we have an interest in mental health literacy, particularly how do we build mental health literacy? How do we reduce stigma? How do we encourage young people and their families to seek help early? We want to know whether young people are having a positive service experience and what contributes to that positive service experience, and also their families. We want to provide holistic psychosocial support. So we want to have an impact way beyond just mental health symptoms. We want to ensure young people that their mental health is improved, their quality of life is improved, that we look at their well-being, their social and economic participation. And Headspace also has a role in system change. We want to reorient the mental health system. We want it to be integrated. We want it to be person-centered, built around the needs of young people. So not built around the system, but the system needs to be built around what young people's needs are and guided by their needs. Here's an infographic of just some of our data, some of our outcomes. So you can dig these up online, but you can see that we would argue we have definitely improved access. We have now provided services to 626,000 young people and over 3 million occasions of service. We achieve positive outcomes for about 68% of young people, and we've got some new data hot off the press where we've got some different outcome measures, and over 72% have clinically significant change on one of several of our outcome measures. Headspace has become very well known. Over 3/4 of young people in Australia now can tell you that Headspace is the go-to place for youth mental health. We've highly recommended by families, highly recommended by young people to other young people, are seen as a vital community service. People say, both families and young people say, that being involved with Headspace helps them to better understand and manage their mental health, that it helps them to have a better quality of life. And we're achieving some important psychosocial outcomes for young people. For example, those who've been involved in the work and study outcomes. For those who engage well, the majority of them go on to have a job, be fully engaged in work and study, and are much more productive with fewer days out of role. We do all sorts of research, like Jigsaw. It's hard to know what to focus on. We have a whole range of research and evaluation. So I'm just going to talk about just a few little bits of that research that hopefully will interest you. But Headspace itself isn't funded to do research. We're a service provider operation, and that's what we're funded to do. But we do get in and we partner to undertake research. But one of the things we have done, we started in 2018, was to commission a national youth mental health survey, because national surveys weren't being undertaken in around our age range at all in Australia, particularly understanding the needs across the whole 12 to 25 year age range. So we commissioned a group called Colmar Brunton, who in 2018, they undertook a survey for us and got a nationally representative group of young people across Australia. We asked them specifically to get quotas from those 4 age groups, which represent sort of early, mid and late adolescence and early adulthood. We wanted half in each of the age groups to be male and female. The Colmar Brunton used their panels, their research panels. They also did random digit dialing. And in 2018, they did a computer-assisted telephone interview with over 4,000 young people. We redid that survey in 2020, in May to June. At that time, we did the same thing, but we did a computer-assisted survey for just over 1,000. And we implemented an online survey and had 5,000 young people in the online survey. And we did that because we wanted to start, we'd argued we wanted to start doing this survey every 2 years. CATI surveys, the computer interview surveys, are very expensive and they have some issues as well. So going forward, an online survey was potentially a better approach. But one of the really interesting things you'll see over there on the right, those are some data using the Kessler 10, the K10, looking at the proportion across that whole age range that reported high or very high psychological distress. And you'll see in 2018 that 32% of the young people reported high or very high psychological distress. In 2020, that had barely moved. It had gone up slightly to 34%, despite the fact that most of Australia was in lockdown at that stage, because that was the time that COVID was starting to take hold. But what's of particular interest, at that same time, the online survey showed 47% of young people being very distressed. So a 13% difference between those modalities, which is something really important for us to keep in mind, the mode effect. And here we would argue that probably young people are more likely to disclose in that online self-report environment rather than through a telephone interview, but a huge mode effect there. And we'll have to keep that in mind going forward. As I said, we're hoping to do this again sort of mid next year-ish. In terms of research, we've also had a real challenge in how do you measure change? Across this age range, people haven't looked at 12 to 25. So how do we measure change? And here we've had some PhD students. Here's a picture, that's Ben Kwan in the mugshot. He did a PhD with Headspace, and he started off by doing a systematic review of mental health outcome measures for young people, finding that there weren't very many good measures and giving some support to using the K10. But as a result, we worked with young people and developed our own measure called My Life Tracker, which is something very, very simple that looks at 3 areas of important young people rate in terms of how their life is tracking. So you can see the 5 different domains there, and we've implemented this routinely in our Headspace data, and also incorporating that as one of our routine outcome measures to look at change for young people. We also have had to develop a whole lot of other measures because we found there weren't suitable measures for us in the literature. And I know Jigsaw has had to do that as well. But we started off, we developed our own service satisfaction measure, and we've published that. We developed a family and friends measure, and we developed an electronic psychosocial assessment tool. We have routinely implemented these, and we use this information to feed back throughout our system. And there's a photo there of Sally Bradford. She also did her PhD developing the psychosocial assessment tool. Some of you will recognize Pat McGorry behind her, who is, of course, one of the forefathers of Headspace. And with her is our Prime Minister at the time, Tony Abbott. We were going through a stage of numerous Prime Ministers there, but Sally's work won an early career research award, and that was at her award ceremony. So we're very glad to have been able to facilitate young people's research careers in that way. One of the foundations of our work has been the development of our minimum data sets, and that's been a massive change process, huge change, and a huge learning curve, particularly for someone like me. But we have implemented minimum data sets, a lot of people would call them maximum data sets, in all our services. And HAPPY is the acronym for the Headspace Application Platform Interface, which is what we use to collect data. The data is used for more and more and more purposes, and we collect data from young people and their service providers, and young people fill in data at every occasion of service on an iPad. Now, with online services, they're having to fill them in, on their own devices before they come into an online session. But we've built up an extraordinary resource and use data in multiple ways. So for the future, and obviously the story continues for Headspace. We're about 15 years old, so still in our early adolescence ourselves, and a great deal more to achieve. Headspace has a vision that all young people would be supported to be mentally healthy and engaged in their community. And we want to still focus on the 4 core service stream areas, but what we're increasingly wanting to do is to have what we're calling one Headspace, that young people have a joined up experience, that they can go online, they can manage a lot of their own services, they can build their own kind of support platform that includes an integrated online peer support as well as clinician and in-person support. So we're working towards this as an ideal. All our services, we aim to be evidence-led and particularly to be youth-led. That there is a photo of the current high energy group, and as I said, we've had youth participation from the outset. We're still working very much on youth participation within our research and evaluation. High energy are involved in that, but I'm interested to learn later on today about Jigsaw's youth participation in research. But being evidence and youth-led are what we want the underpinnings of all our Headspace services to be based on. We have what we are now calling our evidence building strategy, and you people are actually the first to see it. Bits of it apart from the Headspace executive. So we're just about to launch it. You'll see it very similar to, and we have borrowed shamelessly from Jigsaw's research and evaluation strategy. But we have 4 main areas. So creating new knowledge through research, evaluation is essential. We need comprehensive monitoring of all our services, and we need to be able to improve services by effectively transferring knowledge. And just very quickly, what we're focusing on in the next part of our strategy in each of these areas in terms of research, and our focus on creating new knowledge will be primarily to use the data we have to its fullest extent. We have a lot of data now. We have a lot of resources that we've invested in developing. So we want to accelerate the use of our headspace data, particularly our minimum data sets, to be able to analyse it, to better understand young people's needs and what their service pathways are. In particular, we need to focus on understanding workforce capacity. We have a major issue in Australia around wait times and demand. We've been too successful to some extent. There's too much need. Every headspace centre and service, when they are opened, they become quickly overwhelmed. And we have a real challenge in the workforce capacity to meet that need. We also have some specific research priorities that we've identified. So we're very interested in brief interventions, in family inclusive practice, in alcohol and other drug use interventions that are appropriate. We're going to have a real focus on models of care for Aboriginal and Torres Strait Islander young people, and particularly we're now able to do this because Headspace has employed Dr. Lily Brown, who is an Aboriginal woman who has come in as Executive Director, Aboriginal and Torres Strait Islander wellbeing and engagement. So she will be able to lead our work in that area. We also need to continue to rigorously evaluate our services, and as we have more and more services, we have more and more evaluation. And we want to focus on being more systematic and having a bit more of a planned approach to evaluation. Because very often we're reactive because we've just had more services coming on board. So we want to have an annual evaluation planning cycle, and we want to focus a bit on the one headspace. So getting frameworks to look at this integrated headspace, digital plus in-person services. How can we effectively evaluate a more holistic framework? We also have to support external evaluations. We have one currently underway, and we want to be able to use our data more and look at how we can inform the Headspace Model Integrity Framework, which is the way that we look at our Headspace services operating the way that they were intended according to the model. We need to comprehensively monitor our services. So we need the best information to be available when and where it's needed. So this requires more work on data integration. We need to be able to manage our MDS content across all our programs. We need to keep working on having comprehensive and accurate data. Particularly, we're interested in monitoring wait times and demand, and to be able to see if demand strategies and ways to increase capacity impact on young people's experience. We also need to monitor our research and evaluation activity, which is hard to keep track of, so we're going to have a focus on that. And finally, we need to continue to focus on translating knowledge. So we want to boost the impact of our evidence throughout the whole network. So this will be through key knowledge transfer opportunities. So through the Headspace Forum, we'll hopefully be able to get together in person next year at the forum. We plan to have an engagement plan in every evaluation. We need to work on consistent data interpretation so that people can understand all the data and can use it to improve the quality of services. We've started a minimum data set data insights snapshot series. We're wanting to put in place a research register. And the last thing I want to say, we want to build connections with international collaborators to share our knowledge. So it's wonderful to have the opportunity to be involved today. And just finally point out that our key international partners that we'd like to collaborate with are particularly Jigsaw, because Jigsaw has been on the journey with us with Headspace, and also our Canadian compatriots at the Foundry. So thank you for listening to me, and I look forward to your questions.
Thanks, Deborah. That was great. I was hanging on every word. And so interesting just to hear the parallels with the work that we do in our team, but more broadly with the organisation. And the scale at which you operate is just phenomenal, obviously. So incredibly impressive. So we do have some questions. I'm going to do my best to put some of those to you, a bit of a mix in terms of themes. So just with regards to some of the questions that have come in around service delivery first, maybe. One question was, what are some of the learning points that have been realised from the delivery of the online chat mental health services in your experience?
That's a really interesting question, and I think one of the learnings has been, I mean, we, like you, had to move very quickly with COVID to going online, and it was extraordinary how quickly and well services did that. And just goes to show, I guess, this is something people have been working on for a long time, but necessity is the mother of invention, and we pivoted very quickly to that. However, it doesn't work for all young people, and it doesn't work all the time. And we did very quickly tried to do some research around that, and we've been doing research, and we found a lot of young people like it. A lot of young people prefer it, and certainly want to keep it as an option. Some young people hated it, but they were the minority. I think the vast majority of young people really liked it, and particularly if they're already in contact with their clinician, they found it very easy to continue to do that. Clinicians liked it less well. Clinicians don't, in the main, really want to get back to in-person work. So that's something we need to work on. I don't know why that is, but there's a bit of a disconnect, I think, sometimes with what many young people want, but not all. But certainly the majority of clinicians don't want to do the majority of their work online. They like in person.
Okay.
Except for the e-headspace clinicians. We do that all the time.
Absolutely. I think, again, some parallels definitely with what we've heard and reported on here too, actually. There's a couple of questions around engagement with different groups. And you spoke about engaging Aboriginal people and other minority groups. So there was a question there around, whether or not Headspace would have done anything differently to engage those groups, or how successful it's been overall, and whether the diversity in the country is reflected in staff. I know you spoke about challenges in terms of workforce too.
Yeah, and they're the big questions for Headspace, and big challenges because of our diversity, and the issue of staff in the context of workforce shortages. It is in the Headspace model integrity framework that having a diversity of staff to match what the community needs are is something to work towards, and we've recently started measuring and capturing, monitoring what the background of staff are. But it's very hard to recruit staff and have workforce, particularly for Aboriginal and Torres Strait Islander people and other groups. There are opportunities to, for example, become a clinical psychologist. There has been a lot of work to get them through, so it's very hard to get that workforce. I mean, Headspace has been aware. We've had quite some success to some extent with Aboriginal and Torres Strait Islander young people. They make up about 4%, I think, of the Australian population, and overall we've had about 8% of centre clients are Aboriginal and Torres Strait Islander, but they're very uneven. You know, some areas have big populations and some areas have very little. So there's still a huge amount to do. And with Dr. Lily Brown coming on, and we've just had a big project looking specifically, does our model work? And Aboriginal and Torres Strait Islander people are diverse too. Some of them live in the middle of Sydney, and some of them live in remote communities. The cultural and linguistically diverse groups, that's really hard because they're so heterogeneous as well. And you really need to look at each group. And here is where a Headspace Centre needs to be responsive to its community. The people in that community understand the community. So how do you work with the population groups, you know, the young people, and you need to learn. But those are areas we know, I mean, they will continue to be a work in progress, and it's challenging. Yeah.
Yeah, and I know you've obviously published some good papers on engagement with Headspace services. There are a couple of more questions about engagement, so we could share out those links maybe after as well for people who are interested. There was one question as well. I mean, it's interesting to see, as I said, the evolution of Headspace and the change in terms of commissioning and modelling, and also the work that you've done around brand awareness, and to see that grow. Do you think that there is a tension between that growing brand awareness and growing demand for services, and any advice around how that's managed? Yeah.
It is a tension. And I guess we're addressing that by the One Headspace and the digital offerings that we obviously, you know, it's awareness is a good thing for young people. We want them to have good mental health literacy, and their families. But obviously, if you raise awareness, you need somewhere for people to go. So online is somewhere with unlimited capacity. So that is one place. So we're investing in that. But it is the case, and we've had feedback before when we've done campaigns. You know, some centres will go, "Oh no, don't do a campaign. We don't want to build up demand. We're struggling already." So there is a tension there, and we are working desperately to build capacity in a range of ways. Like in Australia, I think we've realised there is no way we can have appropriate in-person support to every young person in Australia, because, you know, they're too far away, it's too diverse. We have to think really innovatively, how can we provide that, and think of new ways to work to do that, which you know, we don't know of yet. We have to keep innovating and thinking outside the box.
Yeah, that's great. Thank you. I'm conscious of time. So many more questions that we didn't get to, but I'm also aware we do have the panel discussion in the afternoon, so try and incorporate those questions into our discussion there. So thanks again, Debra. That was fantastic.